Oh, hello Komal. Good afternoon.
Good afternoon, sir.
Okay, thank you. That means I am audible. Let us start our class, and others may join on later or may see the recordings. Okay, can we start? Because after this class we have the third batch class, and we cannot afford our class to be delayed more than 5 minutes. So that we should start now. Otherwise, we will be delaying. Okay, or otherwise we won't be completing our 1 hour. There is a background noise in your audio, but you have to read.
Okay, sir.
Okay. Uh, Yesterday, after taking back-to-back 3 classes, my voice got uh, cracked. So I am using this headphone today, so that I don't have to raise my voice louder. Okay. So we were discussing about aphorism number 5. In aphorism number 5, we were dealing with the why in the chronic disease we need to know the whole history of the chronic disease and the most significant point of that. And we counted it is necessary for knowing the fundamental cause, and we counted those things which are to be followed or which are to be noted. Altogether, 7 things have been mentioned here, and these we have counted yesterday, and these are called accessory circumstances. Okay, these accessory circumstances have been mentioned in aphorism number 7. If you follow the fourth line, there it has been written accessory circumstances. Just underline that in aphorism number 7, fourth line. Just underline accessory circumstances. Okay.
Okay, sir.
Okay, and you will get the same thing in aphorism number 18, sixth edition, with the name of accompanying modalities. Accompanying modalities. Okay, in the sixth edition, 18, aphorism number 18, sixth edition, there it has been written accompanying modalities. Okay, very good. Now we were discussing about the constitution, important of constitution in knowing the important of this constitution in knowing the or guessing the fundamental cause. Okay, we have discussed how to guess, how to locate a syphilitic constitution, a tubercular constitution, a soric constitution. And there are, what is constitution? We have told that constitution is the physical and mental makeup of the patient. In most of the in Allen's keynote, you will find that those first line are mentioning nothing but the constitution. So this constitution has got a role in our prescription. Okay, like from the viewpoint of miasm, locating the miasm, what miasm is there, and from the viewpoint of this prescription of particular medicine. Okay, I want you to open Brainia.
Okay, sir.
Okay, the first line. The first line, first two paragraphs. Read that.
It is best adapted to a person of gouty or rheumatic diathesis prone to so-called bilious attacks.
Next.
Bryonia patients are irritable, inclined to be vehement and angry, dark or black hair, dark complexion, firm muscular fiber, dry, nervous, cylinder pupil. Next.
Okay, so we are discussing some cases of prescription practical application of these. Okay, so let me discuss with you a case. Initially, when I was sitting at other locality, my initial days of chamber, the one padas, you know that there are some gunda type people in every pada or every mohalla, and that kind of one person, in that kind of person, rigid muscular fiber with appearance, and came all of a sudden came to my clinic and start talking in this sense. Doctor, I have this cough. मेरा मेरा ये कफ हो रहा है, हमको समझ में नहीं आ रहा ये क्यों हो रहा है. This is the cough. This is the cough. Please treat it. Please treat it. And I want that patient to go out of my chamber as soon as possible. Okay. So I just at looking at him, that constitution is of brainia and irritable. He is irritating, and more he is telling, and more his cough is getting aggravated. That is one of the modality I am getting of brainia. I prescribe in brainia 30 in few doses, and got rid of that patient from my chamber. Okay, and that patient, whenever I meet nowadays, whenever I meet him, he tell me that, doctor, at that day you gave me medicine, single dose was enough. Single dose have cured my cough. But I was, we are thinking that homeopathic case taking are so long until and unless we are getting whole case, we won't be able to prescribe. That is not often the case. That you need to sometime prescribe on the basis of 153 in like that, in that case. Okay. Peculiar, common, striking. What is striking to your eyes? What is striking to your senses? And that is not important. It is not always possible. Case taking can kind of person, he will chances are there that he will start quarreling with you. Okay, that kind of person. So brainia do hatao jaldi se. So that was the prescription on the constitution. Okay, most of the Allen's keynotes medicine in the initial few lines is discussing about the constitution, and these are very important. I have prescribed one medicine, or again, that sarsaparilla. Go to sarsaparilla. Look for dark haired person, lithic or psychotic diathesis. Okay, great emaciation, skin becomes shriveled or lies in fold. Shriveled and lies in fold. Whose skins are lying in fold? Those who are older. Age is more, those who are of older age. But if you are finding a person of this kind of constitution, think of in young age, think of sarsaparilla. I have prescribed this sarsaparilla on the basis of skin fold. Okay, great emaciation and becomes shriveled or lies in fold. One of the indication for lycopodium is wrinkled forehead. You will find patient of lycopodium having wrinkles. Even in young age, you are finding wrinkles on the forehead. This is one of the indications. So this is the physical makeup of the patient on which you can prescribe. Okay, many more medicine. Phosphorus, often prescribed on the basis of constitution. Okay, so this constitution is indicated a particular group of medicine is indicating you a miasm or indicating you a particular group of medicine or particular medicine, try to search out that medicine if it is there or not, if it is there or not. Okay, so much so for the constitution. Constitution is the physical and mental makeup. We have discussed both. Okay, his occupation, this occupation sometimes is modifying chronic diseases. Okay, the person working in as a fish, as a fisher. Okay, as a who is working in this clay, who are working in clay, and we know from a line in calcarea carb, open calcarea carb, you will get all these are side topics. This is not the part of but mathematica. We are getting by occupation, we can get my, and by occupation we can get accessory circumstances also. To those are many occupational diseases. Okay, many, like varicose vein. Varicose vein in persons who are whose occupations are of standing for so long. Okay, standing for so long. But every person who are in that kind of occupation, every traffic policeman is not affected by varicose vein. Okay, every bus conductor is not affected by varicose vein. Who are getting affected by this vein? Those who are having tubercular diathesis. Okay, Robert is mentioning that person of tubercular diathesis got affected with varicose vein. So there is an occupation and there is a miasm, a diathesis behind, and this is getting the person affected with that tubercular vein, varicose vein. Every person, every lady is not affected with the prolapse of uterus, who are working in the sales, ladies working in the malls. Okay, ladies working on the stores have to stand for so long. But not every working lady is going to develop this prolapse. But those who are affected with tubercular, those who are affected more with psychotic miasm are going to have this symptom, prolapse of uterus. Okay, every person is not going to have hernia, inguinal hernia, if he is constipated, if he is in occupation of such that it needs a what kind of pressure on the abdomen. Okay, but those who are afflicted with the tubercular diathesis are going to develop this this inguinal hernia. Okay, so this is the importance of knowing occupation in locating the miasm behind, locating the fundamental cause behind. Okay, now open, and from the viewpoint of medicine, open calcarea carb, and you will get urinary troubles last from relation upward, from relation last second third paragraph, last third paragraph. You will get uremic or diseases brought on standing on cold damp pavements or working while standing in cold water, modelers or worker in cold clays. What type of occupation you can think of here? Those who are that working with the clay, the modelers, जो लोग मूर्ति बनाते हैं, क्या बोलते हैं उनको इंग्लिश में?
Sculpture.
And like modelers, you can say, जो लोग मूर्ति बना, more correct term I not getting into my head, but those who are working with the clay, and more the farmers. If any farmer after cropping of that paddies coming to you after sowing his seeds came to you for uremic troubles. Okay, think of calcaria. This is one of the important symptom of calcaria. Ischuria, urinary troubles, uremic troubles, hematuria in the farmers or those who are working with the clays. So this you can think of. So from the point of view fundamental cause, from point of view of medicine, we have discussed the occupation. Many more examples can be cited, and why knowledge of this occupation is important. These accessory circumstances are important. Two things: knowledge of accessory circumstances is important for two things. Number one, to know the fundamental cause, okay, and number two, to remove that cause, okay, to remove that cause if it is causing a hindrance in the treatment, if it is acting as an as an obstacle in the treatment, so you have to remove that. So knowledge of accessory miasm, accessory circumstances are helping you in two terms. Number one is indicating the fundamental cause. Number two is indicating the obstacle to recovery. Okay, we will discuss that again. Now, the mode of living, habits. What sort of habit is in indulgence? Where he is a smoker? Where what are his addictions? How he passed his time? By listening to music or by fighting, by quarreling with others? Okay, how he is spending his time? What are his habits? Okay, so that you can differentiate the miasm. Okay, know the fundamental cause, his domestic and social relation, how is he is at home, how is he outside. Okay, again you can locate the fundamental cause by this: those who are suspicious, those who are dishonest, those who are maniacal are indicating a miasm. Okay, as we have read in Robert's chapter disease classification. Go to Robert chapter disease classification, last chapter of that, chapter number 31, third paragraph, read the whole. We have, I think we have read it before, but read it again, the whole three paragraphs summary.
So which
31.
So which chapter? So which chapter?
Chapter number 31. Chapter number 31. Disease classification, a summary.
Okay, sir.
मिल गया?
Sir,
Disease classification.
soda has numerous sensation of vertigo. ये वाला sir.
No. Last chapter of this means disease classification. Soda has numerous, तो वहां पे आ गया ना. First chapter of disease classification, that is chapter number 31. Come to chapter number 31. It's written in Roman. My page number is, I think, 241. I don't know about your book page number. If it is same of Vision publication, it should be 241. Last chapter, disease classification, a summary. Go to that. Ekdam last chapters of disease classification.
Yes, sir. We have all noted the tendency of some operated patients.
No, that, not that. एकदम लास्ट में चले जाओ. डिजीज क्लासिफिकेशन चल रहा है ना, एकदम लास्ट में. द डिजीज क्लासिफिकेशन अ समरी, चैप्टर नंबर 31. It's written there. Chapter number 31. This one. Chapter number 31. Got it? See chapter number 31. This is
Okay, sir.
disease classification or
Yes,
summary.
we'll get.
Okay, thank you. Chal.
Let us summarize the different stigmata, remembering that we may get all seedness of all the stigmata in different grouping in our patient, but one stigma will predominate above all the others. They all have their characteristic difference. The accentuation of SORA is fundamental. The accentuation of syphilis taint is ulcerative. The accumulation of psychosis is infiltration and deposits. We suppress
Underline
the
this.
syphilitic.
SORA is functional. Underline this. SORA is functional. Syphilitic is ulcerative. And psychosis is infiltration. Okay? Sorry. SORA is functional. Syphilitic is ulcerative. And psychosis is infiltration. When suppressed, now
when suppressed, the syphilitic stigma spends itself on the meaning of the meninges of the brain
meninges of the brain,
and affects the larynx and throat in general, the eyes, the bone, and the peristome. SORA
underline this.
its
These are
action.
the sphere of affection for the miasm. These are the sphere of affection for miasm. Meninges, underline, larynx and throat in general, eyes, bones and periosteum. These are the sphere of affection of a miasm. Okay, if a person coming to you with a laryngeal polyp, okay, though it is polyp, but affection of vocal cord, the polyp on the vocal cord, though it is a polyp, a deposit, but it is the affection is syphilitic. A child comes to you with a thick glass. That means the eyes are defective. Child's eye are defective, and we know that eyes affections are of syphilitic nature. Okay, retinal pigmentation, retinal degeneration. These are the affections of eyes which can locate our miasm to syphilis. Okay, this is the indication. High arch palate. Syphilis is also affecting the palates. Okay, soft palate, this palate, hard palate, and cleft palate. These are syphilitic. We have said before also that if you are getting a high arched palate in a person, this is indicative of syphilis. Okay, if a meningeal disease you are getting, if the organic disease of the brain you are getting, it is of syphilitic. While discussing the worms, we have told that Hahnemann is telling the worms are of soric affection, but we are getting the worms in the brain. Okay, neurocysticercosis. This must have a syphilitic affection, syphilitic base, worms in the brain. Okay, if you are getting worms in the bladder like cystosoma, it is the affection of psychosis. So these are the affection of different miasm, and you can locate your miasm by locating the affection of the affected area. Okay, so SORA, read SORA. SORA, underline that, no need to read. Nervous system and nervous centers. Okay, the functional. SORA is affecting the functional plane. Okay, SORA is affecting the functional plane. Clear? Now read the psychosis for which we are here. We are reading for this only. Read the psychosis.
Psychosis attack the internal organ, especially the pelvic and sexual organ. In this stigma, we find the worst form of inflammation, infiltration of the tissue, causing abscess, uh, hypertrophies, cystic degeneration. When thrown back into the system by separation, this stigma causes dishonesty, moral degradacy, and mania.
Moral degeneracy and mania. Okay, so this is the domestic relation and social relation. Okay, this is causing the domestic and social relation where he is doing lots of abusing at home, quarreling. These are the thing indicative of either syphilitic, a murderer. Have you ever encountered a patient who is a serial killer? One of our teacher told us that he have treated a patient who was declared serial killer. How they looks, okay, and what is the miasm playing inside his head? That is syphilitic. Serial killer, cold blood murderer. Okay, he is not getting affected by the suffering of humanity. This indicates a syphilitic base. All the criminals are mostly of syphilitic and psychotic. Okay, the cold blood serial killers are of syphilitic, and we can, as a homeopath, we can treat. I happen to treat a mastan of my mohalla, of my pada. I have told you, with the brainia. That was the acute affection. If he is coming to me now, I must prescribe some antisyphilitic or antipsychotic medicine. That was brainia was some acute medicine for that particular condition. I remember treating a case of during my internship at NIH, a similar kind of case. He came to me, the person came to me with a big tumor of here, of submandibular region of here. Okay, big hard tumor. He came to me and asked for the treatment. I was doing my internship in ENT department. That was first few days of my internship. And when we used to write at NIH, whole long format of case taking is there. And when I got over to personal history, I asked him about the occupation, and his reply was, Dr. Babu, janen to, ami moshtani kori. That was his answer. What is his occupation? What is your occupation? I asked the patient, and he told me, Dr. Babu, ami to moshtani kori. Bujlen to, that in your terms, it is আপনার ভাষায় বললে যদি হয় তবে it was a social worker. I am a social worker. I am doing this. Okay, I was afraid of him that he is a gunda, his occupation, and he is declaring my occupation is this. Anyhow, that particular tumor, let us discuss that case also. That particular tumor was after death of his mother. Okay, and he used to see in his dream regularly his mother died by drowning, and he used to see regularly in his dream that he is saving someone from drowning. Okay, and all of a sudden that dream breaks, and he told me that I am seeing this dream because I am very much affected by my mother's death. So initially I prescribed that person ignitia in LM potency 0/1, 0/2, 0/3, and that tennis ball like site tumor was reducing to a table tennis ball, ping pong ball. Okay, at last it was disappeared. After 1 year of treatment, it was totally disappeared, and finally I gave that patient syphilinum. Okay, I closed the treatment with syphilinum, provided his history, his occupation, the history he gave me, the occupation he gave me, and what all sort of relations he was having in domestic, he was having in his social, okay, in his social community. So I prescribe syphilinum. I have no contact with that patient, but I know that after treatment on the correct line, he may have been reformed, okay, and left his occupation of that moshtani. Okay, so that is the importance of knowing the occupation. That is the importance of knowing the social and domestic relation. Okay, age. What is the importance of knowing the age? if some disease of older age, like diabetes is a disease of late middle age, and if it is affecting a person of younger age, what you will deduct? You will deduct that this is due to some syphilitic background. What Robert is telling, that this diabetes is of tubercular nature. Okay, and we have told that this tubercular may be syphilitic sora, may be psychotic sora. If this diabetes is occurring, that insulin dependent diabetes, okay, that is occurring in the younger age group, younger age group, type 1 diabetes occurring in the younger age group, if it is happening, you must know that this is a some grave fundamental cause is there. Mixture of psychosis, mixture of syphilis may be there. If this diabetes is occurring at the age of 70, that means sora was there, which was not affecting, letting the person was so much strong that this disease of this nature is only affecting the person at the old age. Okay, sexual function, whether he has got a perversion, any kind of sexual perversion, it is indicative of psychosis. Okay, okay, and sometimes it is indicative of syphilis. Okay, and if it is having any impotency, early ejaculation, these are a lack of desire, these are indicative of sora, and etc. You can add on to these your accessory circumstances, which are helping you to know the fundamental cause and helping you to remove the obstacle to recovery. Okay, so this is the importance of accessory circumstances. Now I want you to open aphorism number 94. Aphorism number 94.
While inquiring into a state of chronic disease, the particular circumstances of the patient with regard to ordinary occupation, his usual mode of living and diet, his domestic situation, and fourth must be well considered and scrutinized to ascertain what there
Scrutinized.
is scrutinized to ascertain what there is in them that may tend to produce or to maintain disease, in order that by their removal the recovery may be promoted.
Okay, this is one of the importance of knowing accessory circumstances. Underline this. Their removal, the recovery may be promoted. Particular circumstances, underline. And these are the circumstances which already have been discussed there in aphorism number 5. Okay. Now, come to aphorism number 18.
From this undebatable truth that beside the totality of symptoms, nothing can
There you will get a footnote in 6th edition. Read that. Not footnote, sorry. That's 6th edition. Addition in the 6th edition. Read that.
with consideration of accompanying modalities.
Now go on. Now read like this, na? From this indubitable truth that beside the totality of symptom, with consideration of the accompanying modalities. Read like this.
With this undebatable truth that beside the totality of symptom, with consideration of accompanying modalities.
Hmm. Okay, go on. Read the whole aphorism.
Nothing can by any means be discovered in disease wherewith they could express their need of aids. It follows undeniably that the sum of all symptoms and the condition is उसके बाद in each individual case of disease must be sole indication, the sole guide to direct us in the choice of the remedy.
Okay, this totality is the main guide, the sole indication in the for choosing the remedy. But you have to consider this accompanying modalities, accessory circumstances, which is sometime occurring. See, by totality of symptom, you are getting the indication for medicine if there is in accessory circumstances nothing to be removed. Think of this case. One case comes to you with cough at night. Okay, recurrent cough at night. Okay, and you take the whole case, you took the whole case, okay, with the mortality, with the this and that, form a totality and prescribe your medicine, but the patient is not getting rid of that cough. Okay, what does this mean? The medicine is not acting? No. Here you have to look for accessory circumstances. On inquiring, you found that he used to live in such a place where there is lots of mosquito, and he have to burn a mosquito coil. Okay, and that mosquito coil is causing the cough. Okay, so consideration of accessory circumstances is very necessary. Consideration of this accessory where the patient is in condition of stress, too long stress. Okay, and that is occasioning the disease. Okay, you should advise the patient for removal of that stress factor. Okay, there was my grandmother few days back suffered from dry cough. Okay, she is around 75 to 78 years old. Okay, my maternal grandmother, she is living at different place from us, and one day she asked me about the medicine. I prescribed the medicine. I told her that take this medicine, take that medicine, and the cough was not getting okay. All of a sudden, it flashed in my mind that my grandmother is taking a medicine, a hypertensive medicine, side effect of which is the dry cough. Okay, so whatever totality you are forming, give your medicine. You will exhaust all the drugs in repertory if you are not considering this accompanying modalities, this accessory circumstances. And she was taking that hypertensive medicine which are occasioning the cough. Okay, I asked her to ask her physician, allopathic physician, to, as she is taking the hypertensive medicine even before I started to study medicine. Okay, for 20 to 25 years, even before I was studying in a class 8 or class 9, or I don't know how long she is taking. So I cannot stop that medicine. Okay, so I asked her to ask a physician to change this medicine, and the cough was okay. So what I was doing, I was forming the totality, cough was not getting okay. So until and unless you are considering this accompanying modalities, accessory circumstances in your patient, you are not going to cure. Okay, one thing is that. Other thing is the past history. We will discuss that. Anamnesis, something there in the past which is causing hindrance. Okay, that is also, we called it encapsulated past. You have to discover if there is anything which is hindering your cure. Okay, that is the different topic. But up to this is the importance of knowing the accessory circumstances. One importance was what we have discussed in aphorism number 5, that locating the fundamental cause. Other important of this is the knowing the obstacle to recovery. So we have read aphorism number 94. Now go to aphorism number 208.
The age of the patient, his mode of living and diet, his occupation, his domestic position, his social relation, and so forth must next to taken into consideration in order to ascertain whether these things have tended to increase his malady or in how far they may favor or hinder the treatment. In like manner, the state of his disposition and mind must be attended to learn whether that present may be obstacle to the treatment or required to be directed, encouraged, or modified.
Okay, so these are the again accessory circumstances. Again, if they are hindering or presenting an obstacle to cure, and state of his mind, this is also falling under that accompanying modalities. What state of mind he is in. Okay, constant anger at someone, this is hindering. Constant grief, longing, okay, this is hindering. This need to be modified, directed, encouraged, or modified. Now go to aphorism number 252. Aphorism number 252.
But should be fine during the employment of other medicine in chronic psoriatic disease that the best selected homeopathic antipsoriatic medicine in suitable minutest must dose does not effect an improvement. This is a sure sign that the cause that keeps up the disease still persists, and that there, in some circumstances, in the mode of life of the patient or in the situation in which he is placed, that must be removed in order that a permanent cure may be ensued.
Okay, underline this. Not effect an improvement. That is a sure sign that cause that keeps up the disease still persists. Underline this also. And those should be in order to what we have discussed. Then after forming modality totality of symptom, we need to consider the accompanying modalities also, in which circumstances the patient is. If it is causing disease, and removal of which or encouraging or directed of which, that we have given a common example of sleeplessness in modern days people, that a person comes to you with for medicine of sleeplessness. Ask them his screen habit, how much he is addicted to his phone, and ask him to put on his light while going to bed and surfing the internet or doing whatever he want to do, but after darkness in the room he should not use mobile phone. That screen, the light in the mobile phone is causing sleep. Your medicine on insomnia, you will exhaust all your medicine of repertory for insomnia. You won't get cure until and unless you are considering this accompanying modalities, this accessory circumstances. It's not that patient comes to you and you have to prescribe the medicine. It's not there. Medicine cannot cure everything. So you have to consider this accompanying modalities where there is something in the patient's life which is hindering. Okay, where there is something in the patient's mode of living, his habit, which is hindering the cure or occasioning the disease, we should remove that first. Okay, so this is the importance of accessory circumstances. So two importance we have read of accessory circumstances. One is locating the fundamental cause, other is locating the obstacle to cure, which need to be encouraged, directed, or modified. Other thing we have told along with the totality, you have to consider, as in aphorism number 18, 6th edition, you have to consider that accompanying modalities, that accessory circumstances. Another thing we have added is the events in the past, okay? The encapsulated past, what we call the anamnesis, okay? You will read in Dunham, in this book, Lectures on Materia Medica, in Agaricus. If you have Dunham, Lectures on Materia Medica, you can open that. If you have Dunham,
No, sir.
No, you don't have Dunham. Okay, it's okay to not have Dunham because it is advanced level book. But let me read you Anamnesis from Agaricus, 49, page number, volume 2, page number 49. That the one topic we have told that we will discuss later. Just discuss it a bit. Okay. That this one. I hope it is clear. In the chapter of anamnesis, in the chapter of anamnesis, volume 2, Dunham is dealing with this. Just read this. I am reading this for you. The case of Mrs. B was once supposed of uterine disease. She had been treated by caustics, etc. She complained of aching in the heels, and I suggested agaricus. The whole family had spinal meningitis. 2 brothers had died, and a sister was paraplegic. Agaricus cured the uterine disease. Okay, so here, instead of forming totality on the uterine disease, he is forming totality on the family history. Okay, sometimes totality or consideration of the family history is very important in that cases where the indicated remedies are not working. We called it anamnesis. We call it anamnesis. Okay, so we are telling along with the totality, we have to look for in anamnesis, we have to, along with totality, we have to look for accompanying modalities. We have to look for accompanying modalities, and we have to look for some events in the past, history, family history. That is the thing. You can add there in aphorism number 18, totality of symptom, and with consideration of accompanying modalities and anamnesis, encapsulated past. So we read that agaricus, Dunham prescribed agaricus on the basis of family history of meninges. Okay, SP Day of Calcutta is advocating of meningococcaine. Okay, for family history or past history of meninges. And we know how often we think of those nosodes. Okay, now again we have at some point of time discussed about how acute miasm sometimes occasioned the disease. Okay, that acute miasm in the past we have discussed. I remember we have discussed at some point of time about acute miasm leaving a dent in the personality of the patient. Okay, leaving in the dent in person a dent, a hole. Okay, from which our medicine is not, we are prescribing our medicine here, and this is a big hole in the constitution. Our medicine is going up to this, our medicine is going up to this, not going there. Okay, so you have to first fill up that gap, fill up a gap. Okay, with your knowledge of acute miasm, you can prescribe there some nosode of acute miasm. Like the person who have suffered from measles, you can think of morbillinum as a hole removal, as a gap remover. So preparing the person for the polycrest. Your polycrest is not working because of that dent you have in your personality of your patient. Okay, I remember a case of surgical wound not healing. Okay, I prescribed calendula, but it was not healing. 2 things may be there, that maybe the homeopathy is false. যা পড়েছি সব মিথ্যে. Whatever I have read in Allen's keynote in philosophy is all bogus. This surgical wound is clearly indicating calendula. Okay, I am prescribing calendula, externally giving for cleaning, giving calendula, but calendula is not working. The symptoms in Allen's keynote is wrong. Okay, maybe there is some accessory circumstances in the life of patient that he is doing such a work that is straining and not getting that thing to be healed. Okay, that is possibility. Other possibility was that there is something I noticed in that person, some big holes on the face. Okay, and I asked, what are these? Some scars on the face of the patient, and I asked, what are these? He told me that at childhood the person was of 60 years old, like that, 60 or 55 years old, and he told me that I suffered from smallpox at childhood. Okay, and I was fortunate enough to survive that infection because at the 6th month of age I suffered from smallpox, and my mother told me that I was fortunate enough to survive that infection because most of the persons affected in my mohalla, in my area, got died. Okay, I prescribe on the basis of this anamnesis, on the history of this smallpox, I prescribe variolinum. Okay, the nosode of this smallpox, for nosode for this smallpox we are using, and again I prescribe calendula, and the surgical wound got healed. Okay, that article I sent to an Australian journal of homeopathy, and it got published there. Okay, in that article I discussed this importance of knowing acute miasm. Okay, importance of knowing these accompanying modalities is one thing, and importance of knowing the encapsulated past, the anamnesis, is other thing. So in aphorism number 18 you can add, with consideration to this and with consideration to that anamnesis, Dunham is discussing in the chapter in this book, Lectures on Materia Medica. You will find it here, volume 2, chapter anamnesis. In my book it is in volume 2, page number 49. Read that chapter of anamnesis. Okay, it is dealing with these things past. Oh, okay, so we will rest our class here as it is already going to be 3. I have to start the next class. So any question you are having regarding this accessory circumstances, regarding this aphorism number 5, you can ask today's class, or any class you are having, we can discuss. Anyone having any question? No. So we will meet. Okay, we will meet on Monday. We have completed our 1 month. So those who want to continue can continue the class, or those who want to leave can leave. We will meet by Monday. Okay.
Okay, sir.
Thank you for giving me your attention.
Thank